Hello everyone, I am Dr. Arpit Bansal. This video is regarding cervical cancer screening. After the overwhelming response, many people who are asking whether if they do not fall into the vaccine age group, then how can they still prevent the cervical cancer? So whether you fall within the group or whether you don't fall within the age group of the cervical vaccine, there are some regular tests which is recommended to avoid cervical cancer and prevent it and catch it early. There is one test called as pap smear and one test called HPV test, papilloma virus detection test. So both these tests are OPD procedures. It is taken with a small brush by your local gynecologist to get some cells from the cervix, and then it is seen under the microscope and it can detect any abnormal cells, or it can detect direct HPV virus. So as we know, if you are infected with HPV virus, it is usually an asymptomatic infection, and it takes 10 to 15 years to develop that into a cancer, neoplasia, and then finally full-blown cancer. So that is why HPV virus is called as a silent killer. So that is why this screening is definitely recommended. And as per the WHO guidelines, the HPV test is definitely more accurate. It is slightly expensive, but not that expensive. It is a OPD test. And if you're getting an HPV virus test, it is as per the new guidelines, it is recommended to be done every 5 years annually between the ages 21 to 65 years age. And if you're getting a pap smear test, which is slightly on the cheaper side, then you should again get this between ages 21 to 65 years of age of all girls and women. But it is recommended every 3 yearly. Since HPV test is more accurate test, so it can detect the HPV virus directly. So there is no need to test between the 5 years. You can only test once every 5 years, and if there is no detection, then you can stay safe. And post 65 years, till 65 years, if you have been doing regular pap smear or HPV test, then after 65 years, there is almost negligible risk of getting a HPV virus and getting into a cancer. So there is no screening recommendation after 65 years. And as I mentioned, over testing of pap smears and HPV can lead to over treatment and unnecessary hazard to the patient also, and unnecessary waste of money also. So post vaccine also, if you have already got yourself vaccinated, you may still get to do this screening pap smear every 3 yearly or HPV test every 5 yearly. Now one question is, if the test comes positive, if either the pap smear or the HPV test comes positive, that means you are infected. It may show some abnormal cells in pap smear, or it may directly show HPV positivity. So it is then you should consult your local gynecologist, and you will normally be recommended a second test which is a confirmatory test, which is a small colposcope. A small camera is put there, and under the magnifying glasses some more cells are extracted to just confirm the findings of the previous test. And if it is still found positive, then your gynecologist will recommend you the treatment, so that you can prevent those abnormal cells to develop over the 10 to 15 years into full-blown cervical cancer. Thank you for watching this video. Please spread this video, because this is very useful for all the ladies between 21 to 65 years to get regular pap smear test or HPV test through your local gynecologist. Thank you so much. Please subscribe and please share this video.